Hey everyone, I hope I'm audible. So let's start with the first question for INICET 2025. The question was TMJ is which type of joint, right? TMJ is which type of joint? You know, check कर लेता हूँ उधर हो गया. Sorry for the delay. I hope I am audible. I hope I am audible. So let's start with the questions that were in the INICET May 2025. So first question was uh, TMJ is which type of joint? So basically they have asked about the classification of TMJ, right? So options are compound and saddle, simple and hinge, complex, condylar, and simple. The correct answer here would be it's complex and condylar, right? See, what does complex mean? What does complex mean? Complex means that there are two articular surfaces, right? There are two articular surfaces. There is a glenoid fossa, and then in between them is the articular disc. Such a joint where you have articular surfaces and an intervening articular disc which divides the joint space into two. That is known as the complex joint. And condylar because of the shape of the articulating element, right? So the condylar head, that is the mandibular component, that itself is the shape of the condyle. So that's why option C is the correct answer, right? So apart from that, how else can we classify TMJ? It can also be classified as bicondylar or diarthrodial, which means that both joints work together, like both the joints work. Then it also can be classified as ganglioarthrodial. What does ganglioarthrodial mean? It has two components: ganglimo, which pertains to its hinge-like movement, and arthrodial for its translation. That is the sliding movement of the TMJ, right? So apart from these, how else can be classified? It is a fibrocartilaginous joint. Fibrocartilage, since a layer of fibrocartilage lines the articular surfaces, right? Cartilage lines the articular surface, isn't it? So that's why fibrocartilage is one. Then it is also a synovial joint. Synovial joint, since it has both the synovial membrane and the synovial fluid. Then it is a secondary joint. Now, why is it a secondary joint? The developmental perspective. The developmental perspective. It starts developing in the third month of intrauterine life, right? It starts developing in the third month of intrauterine life. So it is known as the secondary developmental joint. The primary joint is the incudo-mallular joint, right? Incudo-mallular joint. So the incus and malleus, the joint between incus and malleus, the incudo-mallular joint, that is the primary jaw joint. It persists in the third month of intrauterine life. That the temporomandibular joint, it starts developing. That is in the third month of intrauterine life, right? So let's go to the next question. Let's go to the next question. The mesial marginal ridge is cervical to distal marginal ridge in which of the following two? So usually what happens is, let's say in any two, let's say this is the canine. Even in a canine, what will happen? Let's say this is the mandibular canine. So in a mandibular canine, the mesial marginal ridge will be more occlusal. The mesial marginal ridge is more occlusal than the distal marginal ridge. So this holds true for all the teeth except for one tooth. Is that tooth? Right. So mandibular first premolar is the mesial marginal ridge is apical to the distal marginal ridge. So in mandibular first premolar, what happens is that mesial marginal ridge is apical to the distal marginal ridge. Not just that, the mesial marginal ridge, if you look at it from the proximal view, what you'll notice is that the mesial marginal ridge, it slopes at a 45-degree angle, whereas the distal marginal ridge, just like any posterior tooth, is perpendicular to the long axis, or you can say it runs horizontally, right? So distal marginal ridge is flat, or you can say it's perpendicular to the long axis, whereas the mesial marginal 45 to the long axis, just like the anterior, right? So not just it is apical to the distal marginal ridge, it also is angulated at a 45-degree angle, right? So let's go to the next question. Question number 3. The type of spectrum in the resorption lacunae is, so whenever there is an external resorption, so let's say this is the root and so this is the resorption, right? So resorption, it can heal either by anatomical repair or physiological repair or functional repair. So in anatomical repair, what will happen is the outline of the root will be restored. In functional repair, what will happen? Functional repair, what will happen? Only a layer of cementum will be deposited so that the periodontal ligament attachment can be restored, right? So this is the functional. So in case of anatomic repair, now we are not considering the functional repair because according to the options, the anatomic repair seems the most likely condition here, right? So in case, let's say in case it was a functional repair, then in case of functional repair, you cannot predict whether it is an cellular intrinsic fiber or a cellular mixed fiber cementum. Both might be present here. See, since the PDL is inserting there, cellular mixed fiber cementum is definitely there. There might be a layer of cellular intrinsic fiber cementum. In case of we can say 100% surety that whatever cementum is filling this lacunae is definitely cellular intrinsic fiber cementum because it is not giving any attachment to the PDL, right? So this is cellular intrinsic fiber cementum, the cementum that is filling up the lacunae. So the correct answer here would be cellular intrinsic fiber cementum. And the condition that we need to keep in mind while solving this question is this anatomic repair, not the functional one, right? So let's go to the next question. Question number 4. It's the last question from DADH. The following is not regarding differences in primary and permanent dentition. So one of these is not a correct difference between the dentition. Option is primary teeth have a narrow occlusal table. Crown to root ratio is less in primary dentition. Cervical enamel rods are apically directed in primary teeth. And dental thickness is less in primary dentition. So what does option 1 say? According to the option 1, see, let's say this is the primary tooth. So you can see the occlusal table is very narrow. But when you compare it to the permanent tooth, you will realize that the occlusal table is quite wide in the permanent tooth, right? So option 1 or option A is correct. Option B, crown to root ratio is less in primary dentition. This too is correct. In case of a permanent dentition, the crowns look bulky. But in case of a primary dentition, the crown appears very small. So crown to root ratio is less in primary dentition, whereas it is more in permanent dentition. So option B is also correct. Option C says cervical teeth. So in case of primary teeth, all the enamel rods are occlusally directed, right? All the enamel rods are occlusally directed. Now, when it comes to cervical enamel rod, they can either be occlusally directed. At max, they will be aligned horizontally. But in case of permanent dentition, all the enamel rods occlusally directed. But the cervical enamel rods, they are invariably apically directed. So it is the permanent tooth which shows apically directed enamel rods, not the primary tooth. So option C is incorrect, right? And option D, that is the enamel and dentin thickness are less in primary dentition. That again is true. The crown itself is smaller in case of primary dentition, and the thickness of dentin and enamel is also less in the primary dentition as compared to the permanent. So the correct answer here would be C, that is cervical enamel rods are apically directed in the primary teeth. So in case you want to ask anything, you can go ahead and ask me. So do you want to ask anything? So in case you don't have any doubts, these were the questions, right? We are done with these.